Imagine breaking your leg right now, with no hospital, no antibiotics, no anesthesia, and somehow surviving anyway. It sounds impossible, but archaeologists keep finding proof that it happened over and over, tens of thousands of years before anyone wrote down a single medical text. Before doctors had a name, before medicine had a word, someone was already doing surgery, and some of what they got right still shapes the medicine you trust today. Let's start with the procedure that sounds the most insane: cutting a hole straight into someone's skull while they were still alive. It's called trepanation, and it is one of the oldest surgical procedures ever discovered, practiced on every inhabited continent thousands of years before the first hospital existed. Here's the part that should be impossible. Many of those skulls show smooth, rounded bone growth around the hole. That's not damage, that's healing. It means the patient didn't just survive the operation, they lived for years afterward. Some skulls even show 2 or 3 separate trepanation scars, done at different points in the same person's life, each one healed before the next. Someone, somewhere, without a single textbook, had figured out how to cut into a human head and keep that human alive. Then there's a discovery that rewrote what we thought we knew about ancient surgery completely. In 2022, researchers examining a cave in Borneo found a skeleton missing part of its lower leg, cleanly removed, not torn off in an accident. The cut was precise, and the bone had healed and reshaped itself over years of continued life. Radiocarbon dating put the amputation at roughly 31,000 years old, making it the earliest known deliberate surgical amputation in human history. Thousands of years before anyone assumed humans understood infection, blood loss, or wound care well enough to attempt it. Whoever performed that amputation had to control bleeding, prevent infection, and manage the wound well enough for a child to survive and keep living for years in a landscape with no clean water, no soap, and no antibiotics. That is not luck. That is applied medical knowledge passed down and practiced with real skill. So where did that knowledge come from? Partly from the plants themselves. At El Sidran Cave in Spain, researchers analyzed the hardened dental plaque of a Neanderthal who had a painful dental abscess and found traces of poplar bark in his teeth. Poplar bark contains salicin, the same compound your body converts into salicylic acid, the core ingredient in modern aspirin. He was self-medicating a toothache with the same chemical family used in your medicine cabinet right now. Ötzi, the 5,300-year-old Iceman found frozen in the Alps, was carrying a fungus called birch polypore in his pouch, a species with confirmed antibacterial and antiparasitic properties, and Ötzi's own gut showed signs of parasitic infection. He wasn't just carrying supplies, he was carrying medicine, selected on purpose, based on knowledge someone had tested and trusted enough to carry across mountains. But maybe the strangest form of ancient medicine wasn't a plant or a blade at all. It was other people. At Shanidar Cave in Iraq, researchers found the skeleton of a Neanderthal man, now called Shanidar I, who was blind in one eye, missing part of one arm from an old injury, and showed signs of severe hearing loss. And yet he lived into his late 30s or 40s, decades after those injuries. In a world of predators, cliffs, and constant physical labor, a man with those disabilities could not have survived alone. Someone fed him, someone helped him move, someone kept him alive for years, with nothing to gain from it except keeping him alive. That's not a medical procedure. That's a form of medicine with no name. The decision made collectively that a life was worth the cost of caring for it. And it wasn't only life or death emergencies. At Mehrgarh, in modern-day Pakistan, archaeologists found human teeth roughly 9,000 years old with small, precise holes drilled straight into the enamel. Evidence of dentistry using a simple bow drill, likely tipped with flint, long before metal tools existed. Some of the drilled teeth show wear consistent with continued use afterward, meaning the patient kept eating, kept living, kept chewing on a tooth someone had deliberately drilled into to treat decay. Someone identified the problem, built the tool, and performed the procedure. Dentistry, in the modern sense, thousands of years before the wheel. Here's where it gets uncomfortable, though, because we can't always tell where medicine ends and something else begins. Some trepan skulls were cut into after the person had already died, the whole carved cleanly from bone that shows no healing at all, which means that the same surgical knowledge used to save the living was sometimes used on the dead, possibly for ritual, possibly to create amulets or trophies from human bone. The very same skill that could keep a person alive for another decade was also used for something we still don't fully understand. Medicine, ritual, and belief weren't separate categories back then. They were tangled into the same set of hands holding the same sharpened tool. And your body still runs on some of this. Willow bark tea, the same natural remedy your grandmother may have sworn by for headaches, works through the exact chemical pathway that Neanderthal was chewing on thousands of years before aspirin existed in a bottle. Honey, still used in modern wound care dressings for its antibacterial properties, was doing the same job in wounds long before anyone knew what bacteria were. Every time modern medicine discovers a plant compound that turns out to have real pharmacological value, it's often rediscovering something a healer figured out through trial, loss, and careful observation, with zero ability to explain why it worked, only that it did. If you dropped a modern person into one of these camps and told them to perform an amputation with a stone blade and no anesthesia, they would very likely fail, and the patient would likely die of shock, blood loss, or infection within days. But if you brought one of these ancient healers into a modern operating room, handed them sterilized tools, and explained germ theory in terms they could use, there's a real chance they'd pick it up faster than you'd expect, because they were already doing the hardest part. They were already watching, testing, failing, adjusting, and passing down whatever worked, one patient at a time, for tens of thousands of years, with nothing written down and everything on the line. Or every time you take an aspirin, put honey on a burn, or trust a doctor to set a broken bone, you're standing on the end of a chain of trial and error that started in caves with no anesthesia, no germ theory, and no guarantee any of it would work. Most of it did anyway, and most of us never stopped to think about who figured that out first